The period of educated nursing is also known as Nightingale's era, starting from the 19th century up until the 20th century. This period began in June 15, 1860, when Florence Nightingale School of Nursing opened at St. Thomas Hospital in London, England. This is where the first program for formal education of nurses began and contributed to the growth of nursing in the United States. The development of nursing during this period was strongly influenced by the trends resulting from wars, like the Crimean War and the Civil War, the arousal of social consciousness, and the emancipation of women, as well as increase of educational opportunities offered to women. In 1860, the Nightingale Training School of Nurses opened at St. Thomas Hospital in London. This served as a model for other training schools. Nightingale's system was developed and used. Nightingale's system is more on developing the profession with hospitals. Here, Florence Nightingale said that nurses should be taught in hospitals associated with medical schools, and that curriculum should include both theory and practice. So this is the first school of nursing that provided both theory-based knowledge and clinical skill building. Nursing then evolved as an art and science because of the formal nursing education and the nursing service that began during this time. There were nursing leaders during this era who contributed to nursing. The first of which is Florence Nightingale. And then we have Clara Barton, who organized the American Red Cross. Linda Richards was the America's first trained nurse. Lillian Wald is considered the founder of public health nursing. Mary Mahoney was the first African American trained nurse. Lavinia Duff was active in the protest movement for women's rights and resulted in constitutional amendment that allowed women to vote. Margaret Sanger was considered the founder of Planned Parenthood, and Mary Breckinridge was a nurse who participated in midwifery in England and the founder of Frontier Nursing Service in Kentucky to provide family-centered primary health care to rural populations. There were also men in nursing, the first of which were Steve Miller, who formed an organization called Men in Nursing, and Luther Christman, who organized a group of male nurses in Chicago. These two groups reorganized into National Male Nurses Association with the primary focus of recruiting more men into nursing. These are the men and women who honed their skills at influencing others and bridging change, remaining as models for political nurses of today. The next and the last period for the history of nursing is the period of contemporary nursing. Contemporary nursing is also known as nursing of the 20th century. This refers to the period after World War I and the changes and development in the trends and practice of nursing which occurred after World War II. During this time, nursing is already being offered in colleges and universities. Nurses training in diploma programs has become essential, leading to development of baccalaureate degree and advancement degree programs. This is the period wherein licensure exam for nurses is already a priority. There are two nursing associations or organizations that upgraded nursing practice in the United States. These are the American Nurses Association and the National League for Nursing Education. Scientific and technological development marks this period. During this time, health is perceived more as a fundamental human right, and nurses were more involved in community health nursing. Technological advances like the use of disposable supplies and equipments have increased in numbers. The roles of nurses has also expanded. World Health Organization was established by the United Nations, and computers were utilized for data collection, teaching, diagnosis, inventory, payrolls, record keeping, and billing. The use of sophisticated equipment for diagnosis and therapy is also increased during this period. The World Health Organization, established by the United Nations, were fighting diseases and providing health information, proper nutrition, living standards, and environmental conditions. There are a lot more happening in contemporary period of nursing. Up to today, the factors affecting nursing are economics, consumers' demand, family structure, information and telecommunications, and legislations. So that's it for the history of nursing in the world. I hope you learned something and have a nice day.